Hey Julian Finamize, optimizing your humanist, how you move and think matters. And today I'm back with another video talking about when you wake up in pain and you don't know what to do. Good morning. So I realize that you're a little bit worried and scared that you may have some disc damage or you're not really sure what's going on. So I'm just going to talk about some simple things that you can do to help loosen all that stuff up, okay? So when you have pain on the right side, remember pain 101, wherever you have pain, it's never the source. It's usually coming from this side. So most oftentimes it's coming from this left psoas. So just a really tricky muscle because it's your deepest abdominal muscle that you feel in the front, but it's actually attached to the back of your spine. So when you move your pelvis, that's why like if you lay your back and you feel that pain across, well, it's because this could be pulling from here, okay? So you feel it's connected to your diaphragm, and so that's what we're gonna start off with. We're gonna work on your breath first, and then we're gonna work on releasing any of the neck because you're having trouble getting into extension. So we're gonna try to get the body to feel safe again, and so that you can alleviate some of that pain, so we can try to see what we can do to help you move better, okay? So the first thing I want you to do is we're gonna try to focus on breathing onto that left side. So I've talked about deep breathing lots of times, but we're gonna specifically focus on the left side. So to the best of your ability, what I want you to do is you're gonna lean to the right, okay? So you can stick your arm out to the side. So only go, if you have pain, then just go to where you can. So if you have pain here, then that's where you're gonna go. Go as far as you can until you feel pain and then back off, okay? So we don't want pain while we do this. So what I want you to do is I want you to focus on breathing in through that left side. So go ahead, inhale, and then feel that side of the body, and then exhale. Again. And one more time. Okay, so what that's doing is it's activating parts of your brain to allow your body to, again, feel safe. Now what I want you to do is we're going to start by stimulating underneath the collarbone. So there's a myofascial line in the front of our body that is connected from your toe to your neck here. So we can actually start by rubbing your neck, but I'm gonna go into the collarbones just to get the lymph going. So you can tap if you want, just to stimulate it. The stimulation is really good for the brain. And just stimulate that, and then I want you to go to the middle, like where my zipper is, just rub in the middle here. It may be tender, so if you actually find a point right here, there's a tender spot there, that stress and anxiety point. So just go ahead and stimulate that, focus on your breathing, and breathe out. Now what I want you to do is you're gonna go to the hip. Okay, so you can go underneath the rib cage, like rub along the rib cage here. Okay, so you can get push. See if you can find any tender spots underneath the rib cage. See if you can find anything here. So again, same thing, breathe into the area. One more. Now what I want you to do is I want you to tap that hip. You can do both sides if you want, that's good. But you can just tap the hip, the front of the hip bone, or the ASIS. There's a hip bone right here. Okay, tap that. So this is a neuro stim, just to try to, again, stimulate the fascia, just to let the body know by having the vibration. It just tells the body we want to get movement going, and we want to try to alleviate any of the pain that you may be having or experiencing, okay? Cool? All right, that's good. Now what I want you to do is we're going to focus on flexion. So we're going to just do a couple neck things. So go ahead and stick your neck out, bring it back in, out, bring it back in, one more time. And when you come back in, you want to feel stretch right in the back of the occiput or back of the head here, okay? So you're pulling it right back and feel that stretch there, okay? So you might have to look down a little bit to be able to get there, but please do that. Okay, next what I want you to do is you're going to pull that skin that we were rubbing before. I want you to pull that down, tilt your head to the side, and give me 5 yeses. 2, 3, 4, 5. Focus on your breathing. 5 nose. 1, 2, 3, 4, 5. Now move your jaw around. 1, 2, 3, 4, 5. Jet it out and in, out, and move it around. Is it tender on this side? Okay. Now let's go to the other side. Pull that skin down, tilt your head to the side. Again, give me 5 yeses. 1, 2, 3, 4, and 5. 5 nose. 1, 2, 3, 4, and 5. Now jaw. 1, 2, 3, 4, 5, and then jet it out. 1, 2, 3, 4, 5. Okay, so there might be some crunching and whatnot, so one side's gonna feel a little bit more painful than the other, so now what I want you to do is you're gonna tuck in that chin and we're gonna count down. So make sure you're straight on, okay? So I don't want your head tilted to the side. So you're gonna be straight on and we're gonna count down from 10. Go ahead. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now we're gonna go to the back of the head, okay? So keeping that head straight on. So I'm just gonna push in the back of the head. I can do both hands if I want, or just one. I'll just do it sideways here. So go 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Now we're going to go in front with the hands. So we're going to go back to, so by pressing here, that actually activates all the flexor muscles. So when we get to flexion, so if you go into that rounded position, you don't feel safe, well, this is going to activate the core to do that. When we go behind us, it works on extension, so it works on the posture muscles. We're going to come back to that. What I want you to do right now is hands in front, shoulders back and down. You're going to squeeze your hands. You're actually going to feel your neck. You should feel your neck muscles activate. And we're going to count down from 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Now we're going to go a posture reset. So how this one's going to work is you're going to place your hands together. You're going to set your shoulders back and down into your back pockets. You're going to look up to the sky. Don't lift your head. Okay, you're going to look up and you're going to think about squeezing from the top of the head right down to the heels. Ready? Ground your feet, look up, shoulders down, back pockets, and 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Okay, so we're activating the flexion muscles and the extension muscles to help alleviate any of that pain. So go ahead and give me some hip circles. Hip circles are a fantastic way to shake off the rust. Okay, so you're not going to feel pain here, so that's good. So we just want to loosen up the tissues that's going on in that back pain. Okay, so that's all we want to do, just loosen that up. So I'm just going back and forth. I do like 5, and just try to find any tight, if you find any tight corners, hang out there. So if you're tight out here, hang out there. If you're tight out here, you have pain, then don't go there. Go to the range of motion that you don't have pain, and we're just trying to let the body know, let the brain know that we feel safe. Okay, so it's all about safety. If you don't feel safe, then that's where the pain comes up, okay? So you can lean to the side, lean to the side. Let's try something. So you're gonna lean to the side and lift a leg, or lift a foot. Lean to the side and lift a foot. Can you do this without pain, okay? What we wanna do is we wanna activate, so make sure those big toes are grounded, activate that core, squeeze your bum and lift. Lean, squeeze, lift. Lean, squeeze, lift. Good, okay? Just do a few of those, okay? That's just all good movements to help alleviate what's going on. Okay, so I want you to give that a go, and then we're going to finish off with a leg traction. So what I want you to do is, okay, so compression or traction with the leg. So if you have pain on the right side, what we're going to do is we're going to traction the left leg. So you need to find something that you can anchor to. Okay, so I'm going to do is I'm just going to anchor the band, and then what I'm going to do is I'm going to anchor the band around my ankle. Okay, so I'm going to go around and around. Okay. So anything you can to try to traction that leg. Okay, and then what you're gonna do is you're just gonna lean back. I'm gonna go crisscross, applesauce like that. And what I'm gonna do is I'm gonna lean back, sit back, and all I want is this leg to feel like it's being pulled that way. Okay, so I'm gonna try to, I can sit straight up, put my back against something, and I can actually just feel my leg being pulled that way. So I'm just tractioning, so I can actually focus on pulling it back and then letting it go. Pull it back and let it go. Or I can just literally hang out here and just try to let it distract. Okay, so it's just, this is traction, really simple. Okay, just hang out here, focus on your breathing. Full exhale. One more. Okay, good. So give those moves a try and let me know if it doesn't work for you. Connect with me and we'll figure out a new plan for you. All right, have a great day.